Welcome to today's lecture on public health through time. Today we are going to examine the question of to what extent did public health improve in the early 20th century. This lecture will be split into 3 parts. The first section will study the work of Booth and Rowntree, 2 social reformers who studied urban poverty at the turn of the 20th century. We will then examine the liberal reforms. These were different measures put into place by the Liberal government to improve lives. We will then examine the extent to which healthcare improved during the interwar years of 1919 to 1939. Let's first reflect on Victorian attitudes to the poor, as these play an important part in the work of Rowntree and Booth. Even by the end of the Victorian age, attitudes to the poor had changed very little. People believed that the unemployed and beggars were lazy and chose not to work. If someone did work, but still lived in poverty, the reason for their suffering was due to their own moral choices, namely, that they must be spending all their money on alcohol and gambling. In other words, most people in the late Victorian era believed that being poor was a lifestyle choice. The amount of personal wealth an individual or family had directly linked to their health and well-being. This is because if you became sick, then you had to pay for your own health care, and if you were poor, then you were more likely to live in squalid, overcrowded conditions where disease would easily spread. This meant, despite all the efforts made by reformists like Chadwick and Snow during the Victorian era, the working class of industrial cities still had a low life expectancy and poor general health. This problem became very apparent in 1899, when there was large-scale recruitment for the Boer War. This was a war against Dutch farmers living in South Africa. Since the British Army was far better equipped, they had assumed that it would be an easy victory. However, the army generals were shocked at the poor health of the ordinary infantry soldiers in their regiment. Only 40% of men who volunteered to join the army were healthy enough to serve. As a result, the government set up a committee to investigate the problem, in what they called the physical deterioration of the people. This led both the Conservative and Liberal Party to agree that more needed to be done to ensure a minimum level of good health of the people. At the same time, 2 businessmen decided to conduct their own investigation into poverty. These were Charles Booth, who owned a shipbuilding company, and Seabaum Rowntree, who owned a confectionery or sweets factory in York. Both were interested in something called the poverty line. The poverty line is like a cut-off point, whereby a person's monthly household bills exceeds the amount they earn. Each month every household must pay out something for rent, heating, food and clothing, in order to reach a basic level of comfort. If the amount they earn is less than that, they sit below the poverty line, and one or more of their basic needs will not be met. Charles Booth conducted research into the poorest districts of London over a number of years, which accumulated in a report that was published in 1903 called Life and Labour of the People in London. Booth discovered that someone who lived on 21 shillings, or less each week, were living below the poverty line, and that this applied to approximately 30% of London's population. He also concluded that this poverty was not as a result of any moral or lifestyle choices by the individual. Their poor situation was purely driven by economic reasons. Between 1899 and 1901, Seabaum Rowntree conducted a similar investigation in his city of York. He then produced a report entitled Poverty, a Study of Town Life. It arrived at the exact same conclusion as Booth's report, that anyone earning under 21 shillings a week was living below the poverty line, and this applied to 30% of York's population. In a similar way, Rowntree attributed this poverty to low earnings, but he also said that large families also played a role, since then there were more mouths to feed. Rowntree's report shocked the nation more than Booth's report, because York was not considered a large industrial city, but rather a fairly affluent city. It proved that this was a problem not isolated to just the capital, but was something affecting families nationwide. Booth and Rowntree helped to change perceptions about the poor. This is because these reports proved that poverty was endemic across the country, and that if someone lived below the poverty line, then there was no means of them pulling themselves out of it. This was especially true of traditional working-class factories, who worked in key industries like mining, shipbuilding and factory work. There was very little if no opportunity for career progression, and so people could not hope to earn a larger wage. The findings came as an embarrassment to the government, as this was at a point when the British Empire was at its peak and Britain was seen as the motherland nation, yet many of her citizens were living in a similar squalor as those living in the slums of the big cities in India and South Africa. Let's now examine the Liberal reforms. These are the changes made by the Liberal government between 1905 and 1914, many of which were based on the findings of Booth and Rowntree's reports. By the turn of the 20th century, more members of the working class, especially in cities, had the right to vote. This meant the government had a vested interest in pleasing the working class, who in turn would vote to keep them in power. The Liberal government were able to come to power in 1905 by promising changes to public health for the working class, especially with a focus on children and the elderly, who were the most vulnerable in society. These became known as the Liberal reforms. The first reform, and arguably the easiest to remember, was the introduction of free school meals. The 1906 Schools Meal Act introduced a hot meal in the middle of the day for children who came from an impoverished household. This was important to their health as it meant that their body now received important nutrients to help their bodies to grow. This graph shows the impact of the introduction of free school meals based on the weight that children gained on average after receiving this free meal. While weight gain is now associated with childhood obesity, in this context it was a positive, as these children were seriously malnourished before receiving their free school meal. However, the graph also shows how their weight drops during the Whitsunday and summer holidays, proving that families could not afford to provide a nutritious meal for their children. During the COVID-19 lockdown, Manchester footballer Marcus Rashford used his celebrity status to campaign for families to be provided with food vouchers, so that children could receive a proper midday meal during the holidays too, based on his own experience of living in poverty as a child. This had a profound impact on both the public and the government, and shows that the fight to improve public health is not yet over. The second important Liberal reform that relates to the health of children was the 1907 Act to provide a school medical service. This meant that nurses visited schools and provided medical examinations and vaccinations for children. It became a crime to not provide basic treatment to your child if they needed it, and therefore reduced the cases of childhood neglect. In 1908, the Liberal government also introduced the state pension through the Old Age Pensions Act. This provided a pension for the poorest members of society from the age of 75. Before this, many elderly citizens simply could not afford to retire, and so continued to work until their health deteriorated to a point when they were forced to stop work. After this, many elderly had to rely on their local workhouse for charity, or become a financial burden to their families. Nonetheless, it had its limitations. It was not universally applied to all citizens, like it is today, and 75 was a very senior age to reach before retirement, with average life expectancy in many parts of Britain lower than this. Finally, in 1911, the government introduced the National Insurance Act. This was the first stepping stone to the National Health Service, as it provided free medical care to workers, and then provided unemployment benefit known as the dole for those who found themselves out of work. However, the Act once again had limitations, since it only applied to those in work. This meant that many working-class women could not gain free medical care, since they did not work, because they were raising their children. Nonetheless, the liberal reforms changed the mindset of the British people. It acted as a shift in attitude from laissez-faire to the belief that society has a duty to care for its poorest and most vulnerable members. This acted as a stepping stone to the establishment of the welfare state that we have today. Let's now examine the extent to which public health improved during the entire years of 1919 to 1939. In 1917, the Spanish flu arrived in Europe, carried over from America by World War I soldiers. It first arrived on British shores in Glasgow, and it was working-class women who worked in the Glaswegian factories that were first hit. However, by 1919, it had infected 1/4 of Britain's population, and a total of 228,000 people had died. The government could not coordinate a national response to the crisis since it did not have a national health service, and so relied on local authorities. Nonetheless, there were several measures put in place to stop the spread of the virus. Town councils displayed posters, and health visitors distributed information leaflets to people's houses and into schools. There was also school closures, alongside the closure of public entertainment buildings, like theaters and cinemas. This is very similar to the government reaction to COVID-19, which shows clear progress in terms of public health response to the outbreak of epidemics. Nonetheless, there was also the spread of misinformation, such as advice to brush your teeth thoroughly, or to eat lots of porridge, which would have been ineffective. Furthermore, it was the overcrowded and unsanitary cities that were worst affected, as they struggled to put sanitation and quarantine measures in place. Another event that impacted the public health of the nation during the interwar years was the Great Depression of the early 1930s. This resulted in high levels of unemployment across Britain. More people had to sign onto the dole, and were no longer paying their national insurance contribution. This meant that free medical services were stretched thin. A doctor would cost sixpence, which was unaffordable for most families, and so many chose to live with minor ailments and pray that the problem did not worsen. However, there were some improvements in public health during this period. Throughout the 18th and 19th century, workhouse infirmaries had provided healthcare to the very poorest in society. However, this often excluded the needs of many working-class people who were living just above the poverty line. During the interwar years, general hospitals were built, and these gave better access to those who needed it, including those who could claim healthcare using their national insurance contribution. There was also more specialist wards established, such as maternity and children's services, or cancer wards. However, the 1942 Beveridge Report flagged up that these general hospitals were not evenly spread across the country, and that especially in more rural areas the provision was far less. After World War I, there was support for better housing. This is because soldiers returning from war wanted something better for their families than the overcrowded conditions they had lived in before. In 1919, a Housing Act banned the building of back-to-back houses, and the government also invested in new social housing. This meant the creation of the first council estates, which sat in the suburbs of the city and were owned by the local council, then provided to families at an affordable rent. Many were built to a proper design, so that they had gardens, running water and private toilets. By 1930, there was also a huge effort to clear slums in the industrial cities and replace these with better housing. In 1914, before the war, only 1% of the population lived in rented council accommodation, and by 1939 this had risen to 14%. It would rise again following the Beveridge Report of 1942. The creation of better housing helped to reduce overcrowding, poor sanitation, and the easy spread of disease, therefore significantly improving public health for the nation. Let's now return to our overarching question of to what extent did public health improve in the early 20th century? Firstly, there was a shift in attitude at the start of the 20th century, due to the reports of two social reformers called Booth and Rowntree. Now, people no longer believed poverty was caused by moral or lifestyle reasons and instead caused by economic reasons, like low wages and high living costs. This then led to the Liberal government introducing reforms to help the most vulnerable in society. Most significantly, they took measures to improve the health and well-being of children and the elderly. Finally, there were some improvements to healthcare during the interwar years, especially in the introduction of new hospitals and council housing estates. However, this was not consistent across the country, and so did not benefit all families. By the time World War II broke out, there was still a significant number of families living in poverty who could not afford basic healthcare treatment. Thank you for watching. Tune into the final lecture in this series to understand why the National Health Service acted as such a significant turning point in public health for the British people.